What if the essential workers don't show up? You have to have food, you have to have transportation, the lights have to be on, someone has to pick up the garbage, the hospitals have to run. What if the essential workers said, I'm not showing up? You communicated so effectively the fear of the virus that the essential workers say, yeah, if everybody's staying home, I'm staying home too. It could have happened. I went through the HIV virus when HIV started. People were petrified. Nobody knew what it was. Nobody knew how it lived, how it was transferred, how long it lived. People were petrified. Nobody wanted to go near it. What happens if the essential workers here said, I'm not going to show up to run the bus. You don't pay me enough to put my life in danger. I'm not doing it. They showed up. They showed up. I just finished communicating how dangerous this was to convince 19 million people to stay home and close schools and close businesses, and the essential workers still showed up. That is a value. They didn't show up for a paycheck. They didn't show up because government asked them to show up. They didn't show up because their employer said, I need you to show up. They showed up out of their values and out of their honor and out of their dignity. That's why they showed up. The person who delivers the groceries, the person who's driving the bus, the person who's driving the subway, the nurses, the doctors, the orderlies, all these people who are showing up every day. Not because of the check. They could stay home too and file for unemployment. No, they're doing it out of their sense of honor and their sense of dignity and their sense of pride. This is their mission. This is their role. They're New Yorkers. They're Americans, and they're going to show up. The police officers, the firefighters. I mean, everyone's petrified. You're going to be a police officer? You're going to pull people over in a car? You're going to go into a house for a domestic disturbance? Wrestle with somebody in the house? You don't know who it is? That's what they do. That's their job. That's why I wanted to thank the healthcare workers. And everybody thanks the healthcare workers. But it's not just the healthcare workers. It's all the people who've been out there all this time, making sure everyone else could stay home. They have higher infection rates. They're getting paid a minimal amount of money. They have families at home too that are suffering, but they're getting up every day and they're doing their job. So as we talk about reopening, protect and respect the essential workers. They need testing. They need equipment. They're putting their lives on the line. Protect and respect the essential workers. Public transportation, we've kept running because they need it to get to work. That's why public transportation continued. We talked early on about closing down public transportation. They said, forget it. That's how the nurses are getting to work. That's how the orderlies are getting to work. Nobody will be in a hospital. Nobody will be there to deliver the food. Nobody will be in the power plant to keep the lights on. Nobody will be at the telecommunications department. Public transportation is vital for them. Well, then make sure public transportation is safe and disinfected. The New York Daily News ran a story today on the public transportation in New York City. And their front page is a picture of a subway car filled with homeless people and their belongings. Respect the essential workers. That is disgusting, what is happening on those subway cars. It's disrespectful to the essential workers who need to ride the subway system. Upstate New York need to ride the buses to get to work. They deserve better, and they will have better. We have to have a public transportation system that is clean, where the trains are disinfected. You have homeless people on trains. It's not even safe for the homeless people to be on trains. No face masks. You have this whole outbreak. We're concerned about homeless people, so we let them stay on the trains without protection in this epidemic of the COVID virus? No, we have to do better than that, and we will.